All right, good evening, everyone, and welcome to ATP Live Monday. Happy New Month! Can't believe it's March already. Hope you had a lovely day. Welcome. So, I'm just going to further share the videos as usual to all the various links so that people can see us and we can start. So those of you joining on Instagram, thank you. Those on Facebook, thank you. Those on YouTube, thank you. So, but let me just quickly share our videos and then we can start. All right. Where's the video? Okay. Okay. Good evening, everyone. You're welcome. If you're just joining, I'm just trying to share the videos and to all our various platforms. So just give me a couple of minutes. And happy new month to you all. Okay, and then let me just. Okay. All right. Let me share. Let me share to my story. Share to our groups as well. Today is the 2nd of March. Wow, the year is running so fast. Okay, then finally I need to pin them to the groups so that people can see them straight away once they get into the groups. Okay. Mm. Okay, so I think I'm done with all the sharing and all the pinning. All right, so good evening, everyone. Gbemisola Boyede. I'm a pediatrician and I'm the anchor for your program today. ATP Life is brought to you by Ask the Pediatricians Foundation. We are committed to the health and to the welfare of all children globally, but especially in sub-Saharan Africa, uh, Nigeria, where a lot of our children are still dying from preventable causes. So we do a lot of health education, information, advocacy, online and also offline. So ATP Live program is just ATP Live Monday is just 1 hour program where you get to ask any questions you may have about the health of your children and get immediate answers live from a pediatrician. So thank you so much for joining me. So if you're watching on our Facebook uh, page or on Instagram or YouTube, I will be able to see your questions or your comments directly. However, if you're watching on any of the Facebook groups, you're welcome to keep watching. But if you have a question and you want to ask questions, you have to click on the video and put your questions directly under the video because that's the only way I'll be able to see it in the control room here. So I hope we got that clearly. So thank you so much for joining us. I want to welcome you to the month of March, and I hope you had a lovely, lovely February, and and I hope the month of March will be better. The month of March, we do celebrate a lot of important days like the Cerebral Palsy Awareness Month. March is Cerebral Palsy Awareness Month. We also have the Down Syndrome Day. So there are lots of things that go on in the month of March. So I'm sure as we go on, we'll be talking about some of these issues. And I hope we all got our children immunized with the ongoing campaign for measles and rubella vaccines. And we've tried to explain to us the difference between routine immunization and the um, supplementary immunization. So I hope we've understood that and we all got our children immunized. I could see a lot of you dropping comments, and many of you got your children immunized, which is quite amazing and quite good. So, welcome. And if you have any questions, feel free to drop your questions now, and I'll begin to answer them. Remember to start with the age of the child. For pediatricians, our constituency stretch from zero, even maybe pre-zero, because we also take our babies in the womb as well. Anyway, but let's just say from zero to 18 years. So that is a huge variety of human beings. Okay, so they all have different peculiarities and all that. So we always need to know the age of the child. The answer to a question may be completely different depending on whether you are talking of a newborn or you're talking of a teenager. So that's why we always need to start with the age of the child. All right, and try and keep the questions concise. Tell us only what is relevant and then ask your questions. Don't also just drop comments without you can drop comment. What I mean, like, don't just leave comments without telling us what you want us to do with the comment, like what is the question, what is your ask, and then we can address them. Okay, so I can't see any question yet, but I guess we are all settling in, and so that is fine. But as you're watching, drop your questions, and most of the topics we answer on live, we already have detailed videos or podcasts that address those topics. There's hardly any topic we've not written about or we've not talked about as far as child health is concerned, because we've been doing this for 10 years. So we've talked about immunization, complementary feeding, breastfeeding, and all the rest of them. So after the live session, you're welcome to check out our Facebook pages for past videos. You can watch them. You can also check them on our YouTube videos. You can also check our podcast, Ask Dr. Gbemi ATP podcast. And you can also read on our website, www.hacksthepediatricians.com. I hope you can see most of the details behind me. We also have our WhatsApp number, which is strictly for if you want to have one-on-one private consultation with our clinicians. However, that is not a free service. That is something you pay for. But if you want free question and answer after the live session is over, feel free to uh, put your questions on our Facebook groups. Well, Facebook groups are open Monday to Saturday, and then we are there to answer your questions 24 hours every day. Um, except for Sundays. So feel free to always drop your question. This program is just for 1 hour, but if you are watching the recording or you are watching us after our program is the live session is over, you can always go to our Facebook group and drop your questions there, and our moderators, our clinicians will be very happy to answer your questions and to support you. We're your partners in making sure that your children are healthy. Our vision is to see that no child should die from things that are preventable, things that are treatable. So that is why we are online and offline as well. So feel free to ask the pediatricians all your questions, and we'll try our best to answer them. Okay, so I'm here. Okay, I've got a question from Instagram. Chibuenyim. Good evening, Doc. My twin boys are 10 months old. I want to ask to wait for, I'm not quite sure I got the question. What are you waiting for? Um, Chibuenyim, some part of your questions are missing, so feel free to update it so that I will know what specifically to address. But I didn't quite get the question. Okay, for Facebook people, I can't see any question. I hope you guys are there. I can see that you're there, but I'm not sure whether it's because you don't have any questions, which is quite unusual. But it's fine if it's also possible not to have any questions. So that is fine. Feel free to, but you can feel free to drop your questions as you are waiting. Um, so Chibwe, we are waiting for you to update your question because I don't know what it is. You I was asked to wait for one, and that was the end. So I wasn't too quite sure um what the question is. Let me just double check that my comment section on Facebook is working because I can't seem to see Facebook. Okay, it seems to be working. Nice. All right. Okay, so while we're waiting for the questions to drop, I started talking about what we call child survival strategies, and I've talked about things like um, female education. We've talked about immunization. Obviously, we've talked a lot about immunization in the past couple of days, and we've talked about diarrhea, ORS. Using ORS to treat diarrhea and all that. We've talked about growth monitoring, why it's so important for our children um, to have their growth monitored. I know I've been getting lots of concerning posts about mothers saying they went for the health centers and their children's weights were not checked because I don't know whatever excuse. But let me just say there's no excuse whatsoever for a child's weight not to be measured in any facility. Every child, for us as pediatricians, every child that's typed into our facility, no matter what they are coming there for, even if they just come to play, we want to check their weights, and that is why we do growth monitoring because majority of children who died under the age of 5, we find that malnutrition is the 50% underlying cause. In other words, 50% of them are malnourished. So uh, most children that would die always have one form of malnutrition or the other in 50% of cases. So we monitor of children very closely, and we know from facts and research and evidence that when children have healthy weight, they're able to fight infections on their own. So that is why it's so important for us that children maintain healthy weight, and we want children to have healthy weight because a lot of mothers also has questions about um they want the children to be very chubby and all that. That's not the goal of the pediatrician. Our goal is healthy weight. We don't want the children to be overweight. We also don't want them to be underweight. We want them to have a healthy weight. So every time you go to the hospital, health center, clinic, you must make sure that they weigh your babies and they must plot it, because I also see a lot of mothers ask questions and they will tell me every weight that has been checked, and already we can see that this child has not been gaining weight well, or this child's weight is really really very low or very high. And it's like people are just taking those weights and they are writing it down, but they are not doing anything about it, or they are not even telling mothers what to do about it. So it's important for you whenever. Good evening, Major Evans. You are not late. You're welcome. We just started. It's important for you to know that whenever they measure the weight of your baby, they must interpret it for you. And I know lots of you come to our Facebook group and ask, is the weight okay? That is fine. We are happy to tell you whether it's okay or not. But it's also important that the people who did the initial measurements should tell you this weight is normal or not. However, even yourself as a parent, you also have a responsibility, because we all have that baby book, growth charts or immunization book. There's always a page on it that has um, like a graph where you can plot the weight of your child, and also plot it, you will see whether the child is falling, because there are always about three lines. Sometimes they have more lines, but they're always about three lines. There's a line that's in the middle, there's a line that is at the very top, and there's a line that is at the very bottom. It is important that your baby's weight should be between the topmost and the lowermost line. If your baby's weight is in between the extreme lines, that means that weight is still within normal centers. But if your baby is below the lowest line, or your baby's weight is above the highest line, that means the baby's weight is either too low or too much, respectively. So it's important that those weights are plotted and monitored and interpreted. Okay, so if the child is already losing weight, it's not gaining weight, and the weight should not remain the same. Again, we also don't want it to be static. So if it is any of those things, then you need to come and see the pediatrician. Our job is to investigate, to find out what is going on. And please, let's stop assuming everything about weight is food. A lot of mothers will say, oh, my baby is eating well, so why is he not adding weight, or why is the weight too much, or something like that. Everything is not only about food. Okay, children can have low weight for other medical reasons, even though they are eating well. So, which is why you need to see us. Of course, food is number one. So, we always want to make sure that the food is not an issue. But once we establish that your child is eating well and it's not gaining weight, we need to start looking for what are the reasons for failure to thrive, what are the reasons why this child is not gaining weight. Also, we want to make sure the child's weight is not too above the chart as well, because there are medical conditions, syndromes that can make children to have excessive weight gain, and we may need to do something about them. Hormonal issues, endocrine conditions. So these are the reasons why growth monitoring is important, and it's important that you come to us if there is any problem with the growth of the child. Okay. All right. Shibu Henyim, I think maybe she's logged off, but I'll watch her when she comes back. We'll answer our question. Okay, but I got a question on Facebook. Blessing say good evening, prolific doctor. Wow, thank you for the compliment. My baby of 9 months old have started having a poo that looks like mucus and seed-like, slightly foamy. Okay, since yesterday, but today the frequency reduced. Yeah, ma, I need your advice. Okay, the first question, whenever people ask about stool, the first thing we want to know is how you feeding this baby. Okay, did you give the baby anything different yesterday from what you would typically give your baby? But I'm happy at least it's reducing. So our children at 9 months old, they are sitting, crawling, most likely they are exploring the environment, so they are prone to putting all sorts of toys and things in their mouth. So it is so important for us to monitor them closely, make sure that we are paying extra attention to the hygiene, we are washing their hands, we're giving them toys or teethers, things that they can that we can wash or sterilize, and those are the kind of things we should allow them to put in their mouth. So some of these things could just be a sign of the child, putting the wrong things in their mouths, and it's reflecting. Or also the kind of food you're giving the baby. We also make sure we need to pay attention to hygiene. We don't want to bottle feed in babies, because most of the time it's difficult for us to clean this bottle well, even when you sterilize them. So there are always those little corners where you can easily clean, and the bacteria and all those germs, they kind of multiply in those places, and when the children drink water or food or whatever from them, they are also ingesting those bacterial culture, and that can lead to diarrhea, can lead to infection. So we prefer you give children food in a plate, you wash it thoroughly and clean it and dry, just like you also do as adults. We want the water that the children drink to be boiled. Some people will say, oh, but I use bottled water. Just make sure it's a trusted brand, because these days people do a lot of things. We've seen people just open their borehole, pour it into those bottles and seal it and sell it. People do all sorts of things in some countries where there's no regulations. So I would rather say be on the safe side. boil your child's drinking water or use water guard or any of those chemical sterilizers as well. So those are things we need to do to ensure that the child is not prone to infections and diarrhea. So bless you, I'm not quite sure which one most likely your baby is having, but since this is going down, I would just say we'll keep an eye and pay attention to all those other things: food hygiene, water hygiene, environmental hygiene, hand washing, clean toys, everything, and then we'll see how it goes on. But if it continues, number one, you can give the child ORS, you can give oral zinc, and then you need to see a pediatrician. But make sure the child is eating well, drinking well, and the thing the child is eating or drinking, they are uh, prepared in a hygienic manner so that the child doesn't have infections. I hope that is clear. All right. Okay, Blessing is giving an update. You say you changed the milk from lactogen to non. Well, it's a possibility. It's a possibility. Change of milk can affect. I don't know. For us as pediatricians, we don't really have any issues with the milk you use. We usually say use age appropriate milk, but you can actually just keep giving the breast milk. And as long as you're still breastfeeding your baby, you don't really need any of this formula, to be honest. As long as the child is still taking milk, even if it's breast milk, that is more than enough. But I know most mothers are looking for that freedom from breastfeeding, so we always like to make sure we give other milk, but they are not absolutely necessary. And if it is causing issues for the child, you may as well just leave it out. And if you have used something and that one is okay, then why not just stick with it instead of changing to another one? So I hope that is helpful. All right, the questions seem to be rushing in now, so now I need to rush. Okay, let's go back to Instagram. I think Chibu is back. Okay, so you said your twins are 10 months, so you went for the MR vaccine. It has finished. Okay, and they asked us to come at 1 year. Is it 1 year or 3 months you want to say? What's my advice on it? Yes, of course, you have to go when if the vaccine has finished. There's nothing we can do. But I'm sure your babies took the 9 months one. So if they've taken the 9 months measles, then the next one will be 15 months measles too. So make sure you go for measles too. I'm not sure whether we're still going to have another campaign for measles rubella vaccine. I will leave that to the our national program on immunization, NPI, and the National Primary Health Care Development Agency. So they will come up and tell us if we're still going to have. And I think eventually the goal will be for us to have the MR as part of our routine immunization and take off just the measles only. I'm hoping that is where we're going. But right now, we don't have enough information. But trust us, on ATP, we will always keep you updated. All right, so make sure you go for the 1 or 15 months, and if before 15 months you hear that there is the MR is available again, you can always go for it. Sorry about that, but it's a campaign, and usually campaigns are time bound. They have a beginning time and a ending time. They are not like routine immunization yet that we just keep giving you every day. So usually for campaign, we do them from so time to so time. Is always time bound. Okay. NASA cakes and shops. Okay. My 10-month-olds are refused to leave breast milk. We don't want your 10-month-old to leave the breast milk. There's nothing wrong because the way you frame the question, yeah, you frame it in a way that you are the baby has refused to leave. No, the baby is supposed to still be on breast milk, so there's nothing refusing to leave. I'm not expecting the 10-month-old to leave your breast milk. So we want you to breastfeed for as long as possible, preferably 2 years. So I personally, as a pediatrician, have absolutely no issues with a 10-month-old who still wants to suck breast. That is completely normal. All right, so it is like solid, everything has to be puree. For this age, it's still not a big deal as well. Your baby is just 10 months old. You are already treating this child like a 2-year-old. It's a 10-month-old. So when we're starting food for 10 months old, they are going to do a lot of mashed, a lot of semi-solid, which is absolutely fine. But from the age of 1, we expect them to do more solid, and it's a gradual process. So baby is just 10 months old, all right? And weight gain is on the low side. What is exact weight? I really need to have exact weights. So I want to make the decision on how low is the low side so we can advise. Your baby prefers breast milk over everything. Yeah, that is not unexpected, but we want the child to eat more than breast milk. But remember that even at 10 months old, your baby still needs to take a lot of breast milk. And then the baby is supposed to be having at least maybe 3 complementary feeds a day. So don't mistake, because a lot of mothers always think we are replacing the breast milk with complementary feeds. We are not. Your baby is still supposed to be taking the breast milk as they were taking before. You are only going to be giving the extra, the solid are the extras. That's are the complementary feeds. That's why we call them complementary feeds, to complement, to support, to add to breast milk. And your baby just needs to take about 3 of those once in a day, and with maybe a snack. So your baby doesn't need to take too much of the solid. So the child should still take more of the breast milk and then have 3 meals a day. And then we have loads of resources on complementary feeding as cake. So if you want to check our website, if you want to check our Facebook page, if you want to check our podcast, we have lots of information on how to go about complementary feeding, how to do it gradually, how to, introduce new food, how to be patient when introducing new food, how to make the food colorful and appealing to the child. And I know most of us are busy mothers and we just want the children to eat the food, sharp sharp, so that we can do a lot of things on our list. But feeding our baby is also important, and we need to be patient with them, okay? And it's okay for the child to still be sucking at 10 months, so there's absolutely nothing wrong with that. Okay, so what can I do so you can start taking solid normally? When you mean normally, what do you mean by normally? You mean taking like the eba, the way you take it, or taking the fufu or whatever. So or eating the rice just normally. So some children also have some sensory issues. So they don't like things that are too hard. They want something soft and all that. It's okay. Just keep doing it gradually. So usually we go from, since you're doing puree now, you need to, I would say, you reduce the puree. You can do it as mashed. So cook your rice very soft, let it be mashed, or your porridge, let it be mashed, things like that. You can give your child, you can, things like swallow, you can give them with all this draw soup like okra soup or ewedu and all that. There are lots of people that also have uh social media platform where they teach you how to make the kind of food that babies, children at this age will like. You may want to also check out some of those pediatric nutritionists and dietitian pages on. They will give you example of things you can prepare that are very colorful, that are very tasty, and are very appealing. Because sometimes I found that the reason why children also don't like some of our food is that some of us say we should not add salt to baby's food. That is not true. The pediatricians never said that. We only preach moderation. So some people say, oh, don't add this, don't add that. Then we want to give our children plain food that doesn't have any taste, that doesn't have any color. Children are not going to like that. So you may want to research into how to make the food more appealing. And of course, patience, because some children are just fussy eaters naturally. There's nothing you can do about them. You just need to be patient with them and keep encouraging them and all that. But at a 10 months old level, we are definitely not in a rush for a 10-month old to be on full solid. We want you to give them semi-solid, mashed, and by the time they're about 1 year, yes, we can now start talking about them feeding themselves with a spoon and being on full solid. I don't know whether that is helpful. If it is, feel free to ask more questions and I will address them. Hanu, welcome. Thank you for joining us. Silas Sarah, good evening, ma'am. My 15-month-old daughter urine do smell concentrated. How does something smell concentrated? I'm a pediatrician and I don't know about the smell of concentration. I don't think I've ever heard about. I know about urine looking concentrated, looking dark, looking, that dark yellowish urine. I know about that, but we don't talk about smell. So, but we have some smell of urine that we worried about. It's really for children who have some metabolic conditions, but most of those smells, they are a little bit tricky, to be honest, because um, some of us don't even won't know what smell it is. But if you think your child's urine smell funny, or and especially if you have not given the child, for example, if you give your child ampiclox, you will smell the ampiclox in the urine. That's the kind of smell I'm talking about. But if you're not quite sure, but you just feel that the urine smells funny, then you can see us, the pediatricians or the doctors. We will take the urine to the lab and then we will analyze it to know whether there's something there that we should be worried about. But otherwise, we don't really talk about urine being smelling concentrated. Urine can look concentrated, can look, and that tends to happen if a child has not been drinking enough water. So what we normally recognize, okay, you say your child is drinking enough water. So I'm not quite sure you're using the right word. If your child is drinking enough water, the urine will not look concentrated. And then if it is smelling funny, it's we all have to know what smell it is before we know what to do. So I would recommend that you get to see a doctor who, and usually they will request for a sample of this urine, send it to the lab, test it, and then we can advise you further about it. I hope that makes sense. Okay, we'll clip that. Agunloye Olubumi say my baby clocked 9 months yesterday. She's supposed to go for immunization today, but because she's just recovering from malaria and infection, we did not go. Okay, why? When you say recovering, what is she having fever? So what you just described is what we call mixed opportunity. Missed opportunity means a child should have immunization and you didn't take the child for that immunization because you think the child doesn't qualify for the immunization. Recovering from malaria is not a reason for a child not to go for immunization. If your child is not sick enough to still be in the hospital bed, then that child is not sick enough to mix an immunization. That is my key word or mantra for parents. If a child is not sick enough to be on hospital admission in the hospital, then that child is not sick enough not to take immunization. Okay, so there are what we call absolute contraindications to immunization, and there are something that are just relative. So your child is just recovering. Is the child still having fever? 39, 40? Yes, then the child should not take immunization. But if the child is no longer having fever, the child is completed his anti-malaria, there's no reason why you should not have gone for your immunization. Okay, so next time I'm taking time to explain what the answer, because I want you to learn the principle behind it so that next time it doesn't happen again. So next time, if that child is already home, usually children who are sick enough to be at home and not be on hospital admission, they are not sick enough to miss immunization. Because if a child is very sick and the type that we don't want to take immunization, they will be on in hospital. That's what it means. So you can go Monday. It's not too late. We just hope your child does not catch measles or meningitis between now and Monday. I hope not. I don't think so. So feel free to go for the immunization. It's never too late to take immunization. We always have what we call catch up on immunization. So anytime that you remember that you've not taken immunization, you can always go and get it. It's never too late. It's better late than never when it comes to immunization. So we'll clip that. All right. Okay. So let's see. I think we've answered your question. Um, Blessing, you're saying based on what you say, if a child is having low weight gain and after seeing the doctor and necessary thing is being done, what be its adequate feeding anything else? My question is, can that child ever meet up with his ideal weight? Yes, it depends on what is causing the issue, but most children can meet up with their ideal weight because once we address the underlying issue, of course, the child's weight will catch up. So, for example, some children do not gain weight because they have heart problem, they have congenital heart disease, they are in heart failure. I just want to give you a typical example so you know what I'm talking about. So, if a child who is failing to thrive because of congenital heart disease, we will do the surgery for the heart, we'll give them drugs for heart failure, then they start to gain weight. So, that is possible. Okay, so once we address the underlying cause of the poor weight gain, the children should begin to gain weight. Actually, that is how we know that we're doing the right thing and we are on board. All right. Okay, NASA, thank you. You've answered the question. Anu is saying, I noticed roaches on my is it your head or what? Or is it on your baby's head? I don't understand the question. I noticed roaches on my by head. I guess you mean baby's head. Now it started scratching his place. What do I do? Mine is 5 months old. How does roaches get to your baby's head at 5 months? I hope is it when you said roaches, I hope you meant cockroaches, because that's what I think you meant. Well, I'm just trying to understand how that happened. Or is that a typographical error? I hope we are on the same page, because I need that to be clarified first before I know how to answer. Number one, how does it even stay on the head? Or do you mean rashes? Do you want to say rashes? Because I read, see, if the word is not written correctly, the answer will be wrong. So I really need to make sure I know what you're writing. Is it rashes? Okay, exactly, because I would have been so alarmed if you say roaches. I was like, how can baby have roaches? Because when you say roaches, I was thinking cockroach. Okay, thank you for that clarification. You mean rashes on your baby's head? Okay. All right. So the issue with rashes is that we really need to know what kind of a rash it is. So there are different kind of rashes. There are different kind of rashes with different kind of causes. A lot of people ask us questions about rashes a lot. Number one, we like to see rashes before we talk about it. We need to know what kind of a rash we're dealing with. Okay. And then when it comes to causes of rashes, there are many causes. Some of them are just pure heat rash. That's the commonest one. Sometimes it is allergic reaction, maybe the cream or the soap or the powder some of us are using on the baby. Babies can react to them, and that can give them rashes, and they can be itchy as well. Sometimes it could be infection, and when we talk of infection, we also have different kind of infection. So we can have viruses causing rashes, and you can also have bacteria, you can also have fungi. So there are lots of things that can cause rashes. So for pediatrician perspective, we need to see it. Then we need to ask you a lot of questions to know whether this is even maybe can react to maybe the food or the drink or whatever drugs you give them, anything at all. So we need all those background information. More importantly, we need to see it, and then that will help us to know what to do. I know a lot of mothers, once they see rashes, they always tell you what to do. There's always one powder, there's always one cream, there's always no, that is not how pediatricians approach rashes in children. The most important question to always ask when you see your doctor or your healthcare professional for rashes is, what is causing the rash? What kind of a rash and what is causing it? Because it is the cause that will determine the intervention. In fact, some rashes may not need any intervention. For example, if your baby is reacting to the cream or the product you're using on the child's body, the treatment for that kind of a rash is just to stop the product, and the rash will just we don't even need to treat it. We don't need to apply any other products on the child. So that is just an example. If it is something fungal, we need to use something antifungal. If it's something bacterial, we need to use something antibacterial. So we can't treat rashes without knowing first what kind of a rash it is and what is causing it, because that's what determines our treatment. So we don't do like some of the experienced mothers, oh, go and use this powder, go and use that cream. Sometimes those products that people recommend for you, they make things worse. Because for example, if your child is having an allergic kind of reaction to something, and you go and use another product and your baby is even allergic to that one as well, you're going to make things worse, not better. So that is why it's important. In fact, the best thing for rashes is actually leave them alone until you're sure what it is you're dealing with. At least in medicine, we always have a saying to say, first, do no harm. In other words, don't make things worse. If you can't make it better, at least don't make it worse. So you must always do no harm. And when it comes to rashes, I think that principle applies a lot. Just leave it alone if you are not sure what it is. Rather than applying this, doing that, you can actually make things worse and cause harm instead. So first, do no harm. Get first to know what it is. And some rashes are even self-limiting. Like if it's a viral kind of a reaction, they just go on their own. If it is heat rash, for example, if you make the room cool and the house is well ventilated, the rash will go on their own. They don't need you to do anything with them. But of course, there are rashes that are due to infections. Those ones we have to do something before they will go away. So if you can post a picture of it on our Facebook group, or if you want to see your own doctor, I don't know which one is easier, you can do either of them. All right, Patricia Banye. So your 7 months old has itchy ears and kept itching so badly and until it bled. Okay, so you've taken her to the hospital. Lovely. The pediatrician said the itching was just a bad habit. Okay. And prescribed ciprofloxacin. That doesn't rhyme. Okay. So sometimes when people tell me things, I just wonder, they don't go together. If your child is itching from a bad habit, the child does not need an antibiotic ear drop. So that doesn't go together. So, but let's just keep reading and all that. But it discharge pulse. So if it is bringing out pulse, then that means it's not just a bad habit. That child is having an ear infection. End of story. And that is why the pediatrician prescribed an antibiotic. So the explanation you were given does not seem to tally with what the doctor is treating. The doctor is treating your child for an ear infection. The hair is bringing out pus. The child is getting antibiotic ear drops. So that is ear infection as far as I'm concerned. All right. So you did the swab test. Exactly. He did the growth of strep. Okay. Yeah. So the doctor is already, the doctor treated your child properly. Um, did the proper test. The germ that is causing the infection, gave antibiotics. So which is appropriate. But your own explanation is what I have issues with. I don't know whether it's the doctor that gave you that explanation or maybe you misunderstood your doctor, because what you said the doctor did seemed to make more sense to me than the explanation. So that explanation is not correct. The child has ear infection. I can tell you that for free. The child had a bacterial uh, what we call otitis media, an ear infection in the inner ears. That is why it's bringing out pus. And we know the particular germ, which is a strep. I would have said your child should be given oral antibiotics in addition to the hair drops. I won't treat that kind of a child with just hair drops. I will give the child oral antibiotics as well. But I know your doctor will know what to do. So your doctor, you have gone for hair flushing, but your post has been cut off because the post is too long, I guess. So Facebook must have cut it off. Okay, but I'm not quite sure what is the next part of your question, but you seem to be seeing the right professional. They've done all the right tests, the right treatment. If the child is not better, just go back to them. Go back to the pediatrician and let them see the child. If you are still not happy with the pediatrician, you can go to the ENT doctors. They are the experts when it comes to ears, nose, and throats. So the ear, nose, and throat doctors are the experts. So if you've seen a pediatrician about ear infection, if it is still recurrent, if you are not yet happy, go back to the pediatrician. If you are not happy with the pediatrician, see the ENT doctors. I hope you're still listening, Patricia. Unfortunately, I can't see the rest of your post that was cut out. So I hope I kind of address what you are trying to ask. Okay, Silas, you were still talking about the urine smell is very strong and shocking. Yeah, I know. So the first thing to do, when it comes to urine, number one, you have to collect urine fresh. So if your child has already passed urine for 3-4 hours, it will smell, it will be shocking. That doesn't mean there's anything wrong. So, but if you're worried about smell of urine, number one, collect that urine fresh, not the one that are stored in the nappies or anything. It has to be collected fresh, and that's the one we're going to be concerned about. And then, like I said, we really need to know what kind of smell. There are kind of smell that worries us, so we need to know, and then we can do the right test. Unfortunately, it's difficult to describe them for parents, but if you see the pediatricians, then we will know what to do about it. All right, okay. I know you know what to do about the rashes. Okay, that's amazing. Um, okay. I think we've answered all the questions I have so far. So good. But if you have any questions, go on. So I was still talking about child support strategies. So we've talked about the G, which is growth monitoring. We talk about O, which is the oral rehydration therapy. And then we've talked about B, is breastfeeding. I talk about breastfeeding all the time. We have a whole week devoted to breastfeeding in August. So I don't think anybody who has been with ATP will say they don't know that breastfeeding is important. Breastfeeding will save the life of almost 1 million children every year. So that is why we talk about breastfeeding. That's why we keep promoting breastfeeding. Exclusive breastfeeding for the first 6 months is a child survival strategy. It is one way to make sure our children do not die. So when you see us talk a lot about breastfeeding, especially for those of us who are in Africa, where we don't have all those uh, facilities for emergency and all those fancy stuff, we better use what we call our low cost technology to deal with things. Breastfeeding is more than feeding. Breastfeeding is about protecting our babies from infections, from diarrhea, from respiratory infections, from all these killer diseases. So it is not just because we want your baby to eat. A lot of mothers always say, "Oh, my baby is always hungry, so I want the baby to eat. So that's why I'm doing formula." No, you're not. That is not the primary reason why we want your baby to feed on breast milk. It's not just about food. It is about protection from germs. It's about protection from allergies, allergic conditions. There are many things that are going. It's also about even you yourself, mothers. You are protected from breast cancer just breastfeeding your baby. It has benefit for the baby. It has benefit for the mother. It has benefit for the whole family. Okay, the father will spend less money on all these formula, and those formulas are more expensive this year. I hope you know. And of course, that money can be used to take care of the family's finance. Okay, and it costs you nothing really, to breastfeed your baby. And of course, it saves mothers, also. And it's not just in the immediate. It's also long term. Babies that are exclusive breastfed, they have better intelligence, they are protected against all these metabolic disorders, including diabetes and the rest of them in future. So we're talking about immediate and long-term benefits. So it's really important that mothers begin to look at this benefit of breastfeeding. And this is not something about, oh, you're living in third world, you guys don't have money for formula, that's why you're doing breastfeeding. No, whether you are in America, the American Academy of Pediatrics recommend exclusive breastfeeding for the first 6 months. The World Health Organization recommend exclusive breastfeeding. NHS, Royal College of Child Health and Pediatrics, everybody recommend exclusive breastfeeding for the first 6 months. That's the best way to feed your baby. It's a child survivor strategist. Okay, so it is something that we should do. So I'm not going to belabor breastfeeding because I think you all know that already. And of course, we talk about immunization. It's also a child survival strategy. There's no reason why any child should die from measles. There's no reason why any child should die from polio or become paralyzed and unable to walk because of polio. There's no reason why any child should be dying from pneumonia, meningitis when we have vaccines. So there's really no point children going through all these various diseases and dying from them. We have the vaccines, so all you need to do is to take these vaccines and our children are protected. So a lot of children, one of the most successful public health intervention is immunization. A lot of our children are protected from death, from disability, and all the rest of them because of immunization. So immunization is child survival strategy. Okay, and also female education. There's health education as a child survival strategy, which is what I'm doing right now. Health education is a child survival strategy. You don't know how many thousands of people tell us every time, thank you for what you do, because I know better. I take care of my children better. My children are healthy. I know what to do, and the children do not die. So it's part of it. So you know how to take care of your children. That is health education. What we do on ATP is one of the child support strategy. Health educating mothers and all that. I've already talked about that before. But more importantly, female education is also a child support strategy. We know that mothers who are educated, their children tend to survive better than mothers who are not educated. So we want our girls to go to school. We don't want our girls to become brides as a child. We don't want all these child brides. I know most of you don't can't relate with it, but it's a major issue, especially in the northern part of the country where girls are being married off as low as 8, as 9, as 13. I mean, it's just so ridiculous. Those kind of girls, they then they have difficulty having babies, all these vesicle VVF and all the vagina fistula, and most of their children die as well. Okay, so we want mothers who are educated, and mothers who are educated, they are usually empowered financially, so they know what to do when their children are sick. They can take them to the hospital. They don't have to wait for baba or father to come back from work before they will collect money, before they will take decisions. Educated mothers are empowered financially, they're empowered intellectually, they know what to do, they can take the right decision, and they take better care of their babies. So we want girls to be in school. And of course, when girls go to school, they don't tend to get married early. At least they'll finish school. By the time they finish secondary school, finish university, they're at least 18 or 21. So, so that would delay them having babies. Most of them don't tend to have a lot of children. They will, they do family planning, educated mothers. So female education, many, many benefits that are essential for children's survival. So children of mothers who are educated, they do better, they survive better, they are more intelligent as well. So we want our girls in school. So that is everybody take the girls to school. Okay, so female education is very important. It's just about strategy. Okay, Patricia is back. Okay, you will take her to the ANC. The pediatrician already flushed both ears. Da, 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 da. No. Okay, so yes, I agree with you. Let's take the child to the ENT doctors. Actually, most of us pediatrician, we don't like. I don't flush hairs. I usually leave that to the ENT doctors, but some people do. Anyway, but I really want you to see the ENT, and I'm wondering whether your child just needs to have oral antibiotics in addition to the hair drops. That's my own personal opinion, but I'm not your pediatrician directly, so I will defer to the doctor who have seen the child. She knows better because she has seen your child. I've not seen the child, so I can only make suggestion based on what you told me, but there are maybe more information that your doctors have that you have not told me. So, but I strongly agree with you that the ENT doctors are the next best thing in this scenario. Okay, so that's appropriate. All right, Agunloye Olubumi, so what can I do to stop recurring E. coli infection in my 5-year-old old 5-year-old daughter, always complaining of stomach ache, honestly good hygiene. So where are they capturing the E. coli from? Where was the test being done? Is it in the stool, in the urine? You need to let me know which one so I know what to advise you. So Agunoye, if you're still listening to me, just let me know where they are capturing things from, where they are getting the E. coli from, because E. coli is something that can be what we call like a contaminant in some of these things that people are culturing. So it's very important. The way when you want to do cultures in children, the way you collect your sample is as important as anything else. If you don't collect the sample properly, you are going to culture anything, and that does not make it doesn't mean that your child has those infection. So I don't know whether you're still listening over me. I just really want you to know where is the E. coli being taken from, so I can advise for stool tests. Okay, now I won't be surprised if they find E. coli in stool tests. You're going to have E. coli there. That doesn't mean the child has E. coli infection. And why are they doing stool tests? Is your child having diarrhea all the time? So I really need to know that. Number one, we don't run stool tests for infection routinely. It's not something we do. Even when a child has diarrhea, we rarely do stool tests, unless your child is having dysentery, like blood in the stool. But if the child is not having dysentery, I'm not running a stool test on that child. And then we don't really need to be treating E. coli if it's coming from the stool. That's not unexpected in that area. But the question is, why are we doing the stool test? Is that having recurrent diarrhea? Having stomach pain does not mean the child needs to have stool test, okay? So it doesn't follow. It doesn't follow. So make sure you see a pediatrician, not just a general doctor when it comes to things like that. Okay, Patricia is saying, is it safe to breastfeed an 8-month-old baby who stopped breastfeeding at 2 months? So what have you been doing between 2 and 8 months old? So I really want to know. You should breastfeed your baby. Anyway, there's nothing wrong with it. The short answer is it is safe. You can always breastfeed your baby anytime, any day, even if the baby didn't breastfeed. So there's what we call reestablish lactation. We can always reestablish lactation. We can even get somebody who didn't have the baby to breastfeed the baby. We have all this kind of technology nowadays. But I'm just curious, really, like what happened between 2 and 8 months, because I would assume that a baby who didn't breastfeed if you didn't breastfeed for 6 months, is there see any hope of getting that milk back? But it's worth trying, and it is completely safe. So breast milk is in your body. It doesn't, nothing happens to it. It's okay as long as it comes out. That is the most important information. All right. Okay, so let me finish my go buffet. That is what do we call it? That is our chart of our strategies. So I think I should just finish it today. Um so that we're we finished. So we've talked about growth monitoring, we've talked about oral rehydration for diarrhea, we've talked about breastfeeding, immunization, female education, health education, we've talked about that. I think another thing I really need to emphasize is family planning. Family planning is also a choice of a strategy. Unfortunately, a lot of mothers don't take it as serious, but for us, I see a lot of mothers telling me, oh, I'm I how do they normally put it? I have a baby 6 months old and I have missed my period, or I'm pregnant. There's a way mom always put them that make it look so funny to me. They make it sound as if it is an accident. Getting pregnant is never an accident. It is something that happens because certain conditions, standard temperature and pressure were met. If there's no standard condition met, you will not get pregnant. So it doesn't fall on you. It's not a virus that you are catching. It's not. So if you are a mother, you are a married mother or even unmarried, doesn't matter. As long as you are having regular sexual intercourse and you are not using contraceptives, you are going to get pregnant. It's as simple as that. It's a matter of when it happens. It's not a matter of can it happen. It's a matter of when it happens. So I'm always surprised when people ask those kind of questions. You say have a baby and now you're pregnant. Even I've seen as low as 2 months old baby and the mother is already pregnant again. It's so straightforward. What were you expecting? You were having sexual intercourse. You were not using family planning. Then why are you surprised that you're pregnant? You're going to get pregnant. And don't blame it on breastfeeding. Breastfeeding does not 100% protect you from getting pregnant, okay? It does maybe 98%, especially if you are doing exclusive breastfeeding, but we've always told you it is not 100%, okay? So, and the fact that you are not seeing your period does not mean you cannot get pregnant. If you are still ovulating, whether you see your period or not, you will get pregnant, okay? So, family planning is essential. Once you go for that 6 weeks postpartum check, you must do family planning. It's as simple as that. You must do family planning. So don't come and ask Dr. Gbemi, what should I do? So it's not good for a baby. A lot of mothers, we don't realize that the toll of getting pregnant, having a baby, breastfeeding, it takes a lot on our body. It takes a lot on the woman's body. So we shouldn't be doing it too quickly. We shouldn't be getting pregnant too quickly. Number one, it's not good for you as a mother because Your body has not even recovered from one, and you want to go on another one. That makes you what we call high risk. Okay. And that makes the new baby, the new pregnancy, also very high risk. And that is high risk for the pediatricians, because now we are worried about you, whether you will carry that pregnancy well, whether you yourself will survive. We're also worried that that baby will not be born premature. We're worried that nothing is going to happen to that baby. So we want you to space those pregnancies. Recover first before you go on the next one. We want 2 years gap between the pregnancies. Yes, minimum is 2 years. So, and the only way to achieve that is family planning. You need to use contraceptives. There is no contraceptive that is even 100%, but there are those that are closer to 99%. But natural method, I don't think it's up to 20%, which is what most of us will think we do. I will use my safe period. I'll use sometimes these things are spontaneous, and some of us like to go for those emergency contraceptives. It's not the best, especially if you are having a baby and you're breastfeeding. You shouldn't be using emergency contraceptives. It's not the best, because you can't breastfeed your baby 72 hours after using emergency contraceptives. So, and there's nothing emergency about you about a mother. Okay, emergency contraceptives are, we use it for people who have experience that they didn't plan for. So they were raped, or things like that. But not for a somebody who is in a in a marriage, who is having babies. We expect you to have coitus all the time. So what we expect for you is a regular family planning, not an emergency contraceptive. Some of us use emergency contraceptive like regular contraceptive. That is wrong, and it's not the best. Okay, go for family planning. There are so many methods. We have the tablets. If you are the type that is forgetful, you can do the injections of every 2 months, or injection of every 3 months. Or if you don't like the injection, there's IUCD. If you don't like IUCD, there is depot. I mean, the hormonal contraceptives that they can inject, and it can last you. We have the ones that they can put in Jadel or the coil. There are so many options. Even the regular condom is still better than nothing. Even the female condom is available. Okay, so but family planning is very crucial. We must plan to not get pregnant quickly. It's not the best for the babies. And most babies that their mother get pregnant, both the one that have happened before, the one that is coming, those two children are at risk. And we sometimes lose one or two or both, or even all three. So family planning is a choice of our strategies. We want our mothers to fully recover from one pregnancy before going on the next. And the family planning clinic are available. I know, so this one makes me hard with that one. There are options depending on your own body type, depending on your health issues. We have multiple options. And so you can pick. You don't have to do one. You can do whichever one you're comfortable with that works for you. But it's better than nothing. It's better than coming to ask Dr. Gbemi what to do, because I'm going to ask you to have the baby. I'm never going to ask you to abort any babies. So that is our own standpoint. But we know it's very risky. Actually, for those of us who even have CS when we're having our babies, please let's do family planning. Once you go for your 6 week immunization, you must ask for the appointment for the family planning clinic. In fact, you should do it the same day, so that before you come home, everything is sorted. Okay, the last question before I go, Hanu. Baby has delayed milestone. If a baby has delayed milestone, what does it entail? Because my BTT said to the left, although we've started physiotherapy, just want to know what to prepare for. Did you see? You should see a pediatrician first. The pediatrician should be able to, because this question you're asking is a 1 hour consultation question. Because we need to ask you all sorts of questions, right from the pregnancy to the delivery to when the baby was born and what has happened. So we need to take what we call that detailed birth past medical history to know, number one, why is the child even having that delay milestone. It is after I know why the child is having the delay milestone, then I can now tell you what to expect, or what is going to happen. That is the most important question, really. You've been through, I can imagine you've been through a lot. I know you encourage exclusive breastfeeding, which I've tried all I could, but my baby refuses to latch. Okay, I stopped trying when it was 3 months. Did you see a pediatrician? If your baby is not latching, that is also worrisome to me. Most babies will suck. There's no reason why babies will not suck and all that, unless there's something else wrong as well. So when we have difficulties, mothers, when we have difficulties with breastfeeding, with any issues, come and see us at that point. If you come to the pediatrician at that point, we will be able to support you and be able to help you. Okay. Um, okay. There's so much that I don't want to write, and Facebook has cut off the rest of it. But bottom line, you need to see a pediatrician. You didn't tell us the age of your baby. You didn't tell us what areas are delayed. There are so many questions I need to ask, but if you can't do we can't do that online, obviously. So I would recommend you see one of my colleagues for a detailed assessment, if preferably if you can go to a teaching hospital, preferably to see a pediatric neurologist or a developmental pediatrician. That's something I do. That's my field. But one of us needs to see this baby. We need to. Your baby is 5 months old. So your baby is 5 months old. So is it just the neck control that you're worried about? Um, okay. If it's just the neck control, I would just say it's pretty early to start worrying so much about developmental delay. But if there are more to it, but I really would recommend, if you have not seen a pediatrician, you should see one. That is just all I can say for now. So then we can advise you further. But I think I want you to relax, because I can see you are so worried and anxious. And even just reading your posts, I can see why you are struggling with breastfeeding, because anxiety is anti-breastfeeding. And then the baby is also not latching. We can support you with baby latching. We can support you with alternative way to feed the baby who cannot suck. There are many things we could have done. But just relax. Don't worry. Don't panic. You can come and see a pediatrician, and they will be able to support you with that. Your baby is still young, so we'll still have time to do your best. Even now, you can still breastfeed your baby. Your baby is still not yet over the age of breastfeeding, so there's still a lot we can do. But you really need to see a pediatrician, and I will strongly recommend seeing one in a teaching hospital, because you're also worried about the developmental area. So that's just my main concern. Okay, so thank you so much, everyone. So we've talked about female education, treatment of infection and hygiene. I think we've talked about all the child development strategies now, and then we'll take it. I will say I've finished dealing with that topic. But if you have any questions still, feel free to post it on our Facebook group. Monday to Saturday, myself, my colleagues, our moderators will be happy to support you and answer your questions. I'll come again next week by the grace of God. If I'm here by the grace of God, I'll be able to answer any question. But if in between now and next week, Monday, feel free to head over to our Facebook group, put your questions there, and we'll answer them. And we'll be also putting our short answers on reels. I realize that many of us don't have the patience to listen to the full video, 1 hour 30 minutes. So what I'm doing this year is that all those short information that are relevant, we'll put it on those 1 to 2 minutes reels. And I think most people like that. At least the attention span is not long enough to everybody can catch the important message. So we'll keep doing that. Thank you so much, everyone. Have a wonderful evening, and I'll see you same time next week. And it is bye-bye. Bye.